I decided to become a pharmacy tech because I'd been in the service industry for 7 years. I just wanted something different and chose the pharmacy tech program because I've always kind of had an interest in medicine and what they do and how they work, both the chemical and the biological side of it. The most challenging part would probably have to be just the sheer volume of all the medicines, remembering exactly what they go to, because some medicines sound and look so much alike, do vastly different things. The most rewarding part of the job would probably have to be just the sense of accomplishment that you get out of knowing that you're a huge part of the medical field, even if it's more behind the scenes. The customers and the patients, they can't get their medicine without you. The pharmacists have a lot harder time doing their jobs without you. It just gives you a real sense of belonging. Everybody likes the same pharmacy. They like to see a familiar face. It builds a relationship of trust between the customer and the pharmacy. And especially if you start to recognize them and you know their name, it keeps them coming back. On the retail side of things, record keeping is a pretty decent part of being a pharmacy tech. You have to deal with insurance, keep up with the patient profiles. They deal directly with the customers, so they're handling pretty much all the transactions there. Making sure that the patient or customer gets the correct prescription. It's all about paying very close attention. Whenever I was finishing up school, I think one of the biggest fears that I had was just the amount of responsibility and being nervous about, oh, what if I screw up on this medicine? What if I send out the wrong thing? And I learned very quickly that it's a huge network of everybody checking everybody else. No one lets anyone send out the wrong thing. Everyone has the patient or the customer in mind and wants to make sure that the team as a whole succeeds. The role that a pharmacy technician plays in controlling the inventory in a pharmacy is more just kind of keeping your eye out, making sure that nothing's getting too low. We handle a majority of the everyday tasks. On the retail side, we deal with the customers, we deal with answering the phones, filling the prescriptions, and on the hospital side, we assist in the IV room, we deliver any medications that the nurses and doctors need, we restock the machines, and we also answer phone calls there. And us doing all of this allows the pharmacist to really focus on the patient themselves, on if they have any allergies, drug-drug interactions, and any dosing errors that could possibly cause them any harm. I really do feel like me individually and also other pharmacy techs are helping people. We're helping the pharmacists, the nurses, the doctors do their jobs better. We're helping the patients and the customers by making sure they just get the drugs that they need to help themselves feel better.
For more information on the Pharmacy Technician Program, visit UnitechTrainingAcademy.com and click on the Pharmacy Technician Program page. Your future starts every Monday at Unitech.